Cafecito, cafecito break. And we are here to hear a message from. Hello and welcome to Cafecito Break. I am Rosangel Perez, one of the Perez sisters. I'm delighted to be here with Dr. Lynn Lafferty of drlynlafferty.com. And before I bring her on to chat with the Cafecito Break community, let me just read you this one paragraph that she has on her website that reminds me of a place that I would love to just kind of go into a portal and visit every single day. Growing up country. I grew up in Western Europe in a small town surrounded by farms. The air and water were clean, the grass smelled heavily, and the food was pristine. My Italian grandparents lived down the street and had a garden of vegetables and beautiful flowers. Every spring, my grandfather would dig up the dandelions and cook them with olive oil and garlic. He would tell us that he was doing his spring cleaning. I did not know until I studied herbs that dandelions help to stabilize blood, sugar, and detoxify or clean the liver. It's too bad more people don't know how helpful these plants are. Now, as an aside, when I was studying and my introduction to herbs, one of the first things I learned was that dandelions had been given a dirty reputation out in these streets as a weed. And then you learn how helpful they are, and then you learn when you start understanding, especially those of us who are in growing up in urban settings like I do. I'm in Brooklyn, New York. You start getting used to being in this urban setting, and you don't realize that maybe if you're feeling anxious, if you're talking too fast, maybe it might not just be the coffee that you've been ingesting or the caffeine. Perhaps it is that you may need a little bit more of doses of nature. And so this is a perfect segue. Welcome to the show, Dr. Lynn Lafferty. How are you today?
Very good. I just want to say one correction. I grew up in Western New York. My grandfather came from Italy, though, and he did live down the street, and that was amazing. And you talked about weeds because weeds are some of our best herbal remedies because they're fighters, right? They don't quit. So they do strong things within the body. So we have to bless our weeds and all the plants that our creator gave us.
What is you if can you bring us up to date as to your background? I understand that you have a very wealth knowledge base of not just the helpful plants and herbs, but even in in terms of like understanding pharmaceuticals. And then here we are as human beings. It's almost like many of us have been programmed to not remember that we have choices like herbs and plants that we might be able to use if we have a headache, if we have an indigestion, or even for things that are deeper than that.
Well, to start off with, my other grandmother, who was part Native American, had a 150-acre farm. She actually didn't have any electricity or running water. She didn't want electricity, believe it or not. My dad was the electrical engineer for Motorola, and I remember him saying, "Oh, I have a team that we're going to put electricity in next weekend." And she said, "Absolutely not. That disturbs the electrical current in my body." I have a PhD in pharmacy and also a naturopathic doctor degree, and also I'm a diplomate in clinical nutrition. I'm an endowed professor at Nova Southeastern University in Florida. And you see behind me all these plants. This is actually my office. And I teach medical students and pharmacy students how herbal remedies work. And then in this clinic, a lot of people come. I would say a lot of my patients have been to Harvard, to Johns Hopkins, Mayo Clinic, and they all hear, "I can't do anything for you. I don't know what's wrong with you. Your labs are fine," or whatever. I also have a big group. I went through, perimenopause was very difficult for me. And that's when I started going to a naturopathic doctor myself. And, and I was like, I went to the number one and number three medical schools in the United States out in California. I lived in San Francisco at the time, and they just put me on a drug that made me sicker and fatter and more miserable. And I and that's what the protocol was. So it didn't matter if I went to the best place in the country or I went to the worst doctor in the country. They all give you the exact same thing. And when I went to a naturopathic doctor, I felt so good. I lost 30 pounds and my hormones went back into place and I just felt great. And so that's why I went back to study naturopathic medicine, because I said, I want to know the pharmacology of how all that works. And we took a year of pharmacology when I was in school, and all these things, these curriculums, we took a year of physiology, a year of pharmacology, a year of what we called medicinal chemistry as a pharmacist. And these were very, very hard courses. Matter of fact, when I walked into school, they said a third of us, this was at University of Georgia, a third will be flunked out by the end. And we're like, well, we have 3.6 averages in calculus and physics, but the professor I had for physiology taught us that the body was very logical, and she would make you I remember one of her questions was, what if you have Addison's, which means you have low adrenal gland output, what happens to the QRS wave in the heart? I don't even know if I got that question right, but one thing I know is that most heart problems really aren't about the heart. They're more about stress and about your adrenal gland. Like, the adrenal gland uses a lot of vitamin C, which is um, in your collagen. And if it doesn't get the vitamin C from your diet, what will happen, it will start breaking down blood vessels. And if some of your blood vessels are weak because you've eaten too much sugar and it's not being handled properly, you might have pre-diabetes or something like that, then the blood vessels start to deteriorate. But they're smart. They put down calcium and they put down cholesterol so that that blood vessel doesn't pop. But over time, now it gets blocked and the blood doesn't go to the heart. And then that would be considered a heart attack, and your heart starts to scar. So it all starts with the adrenal gland. Plus, I've saved so many people from getting ablations where they cut the Purkinje fibers in your heart, when really what you need is your adrenals to be uh you need to slow down and you need to eat more properly, and you take some supplements like buckwheat is one that's great for your blood vessels. It's high in vitamin C, but very high in what they call bioflavonoids that help build up your blood vessels. So there's so many things like that that we can do from our diet So that's what I teach and what I do in my clinic.
That's really impressive. What are some of the, well, I guess if we can take it to like 2020 when the world pivoted so much and some of the recommendations that we were hearing seemed to alarm people. What we weren't hearing was go outside and get some vitamin D, right? Go do some exercise, uh, go be with nature. uh did that shift anything for you when you were seeing that play out, like maybe in media or as in suggestions? Because I know me, I was like, how come we're not seeing more of these suggestions? Because I feel like the world was craving for them, especially because many people didn't even know where their next dollar was going to come from, right? We were grounded. So you're not, the idea of even investing in a pharmaceutical, even if the person needed it, believed in it, they didn't even have the money for it. Oh, I can't hear you.
Can you hear me now?
Yes, yes.
Okay, sorry, I hit the button by mistake. It goes back to my training again. So what we did, medical students too, we took more chemistry courses, and then the medical students took more clinical diagnostic courses our third year of school. So the curriculums were almost the same. We had the same classes, but the last year, where I was at the Medical College of Georgia hospital, we were all the same medical students and everything in the clinic. And I remember this time where we had the first pancreatic cancer case, and the doctors were like, oh my gosh, we've never seen this before. So they said, medical students and pharmacy students, you go to the medical library and go look up, is there something we don't know about pancreatic cancer? And on Friday, we'll have journal club, and you're going to be investigating. And so we did that, and we actually didn't have a computer. We had to go through a card catalog and actually pick up the journal in our hand. And so anyway, we were learned, let's be curious. First of all, they've taken journal club out of medical school. They have it a little bit in the pharmacy school. I teach in both, but medical school, why would you need to go look at research? Let Dr. Fauci or somebody from the government tell you what to do. I was very upset because just recently I did a lecture for about 100 medical and pharmacy students in these three clubs, and one's like integrative, one's like back to nature, one is a nutrition club. So these are medical students and pharmacy students who are thinking outside the box. But I asked them, when you heard COVID, how many of you went to the medical library to see if there was something there for you to use to help save people or whatever? Not one hand went up. So what I did, two things. One, I remembered my mother or my grandmother were on the farm, and she had all these elderberry trees, and she was born in 1900, and when she was 20 in 1920, she treated all these people with the Spanish flu. And she said she treated 20 people, nobody died, and she never got it. And she said, our family never got it. Now, here, my great grandmother had just come from Italy to Buffalo, and she actually died when my grandfather was like 8 years old from the Spanish flu. And that was very devastating to my grandfather in the rest of his life because he was put in a Catholic boys' home. And so anyway, there's so many things if we went to the library. So the first thing I did, I went to the medical library. I put in coronavirus and elderberry, and sure enough, there was a place in Louisiana. It was a nursing home where Corona SARS Middle Eastern had broken out, which is actually more deadly than COVID-19, and they used elderberry extracted in alcohol. Well, first of all, nobody went to the hospital. No one died, and in 5 days, it was gone. So, I got our herbal company to, provide us the elderberry and alcohol. It was very expensive. So, when right now, I have a course online called Become Your Own, Health Investigator, where I teach you to look for all these things, but I also have videos, just for my class because I don't want them taken down from YouTube or whatever, like how to make your own herbal remedy. So you could have made what we are charging $200 for. You could have made at home with an organic bottle of vodka and some organic elderberries dried from one of the places that sell it, you know. So you could have made your own remedy. Uh, the other thing was I went to the medical library because I remembered a study that where there were 2 hospitals in Canada. One hospital got the flu vaccine and the other got vitamin D. And guess which one had less flu that year? It was the ones that got vitamin D. So I pulled about, I don't know, 10 or 15 studies on vitamin D, and one study that I looked at said that anybody that dies of any infection, whether it's fungal, bacterial, or viral, they're all low in vitamin D. Also, I pulled about 20 studies and about zinc, how it blocks the blocks it from even diving into that mucous membrane. It blocks it from getting into the cell from replication, and it blocks it inside the cell either as well. And some of these things like the hydroxychloroquine and the elderberry actually worked. One of their mechanisms was as a what they call an aquaphor for the zinc, that it actually drove zinc into the cell easier for that zinc to go in and block it. So I it was funny because I had I'm really good friends with the man that runs at our county hospital here. He runs the family medicine residents, and I showed him all those studies, and he came in a few months ago and said, "You know, because of you, nobody died from COVID." And I'm like, "What are you talking about?" Because I had forgotten what I'd done. He said, "Remember you showed me those stack of studies?" He said, I didn't care if people had COVID or not. They all got zinc, vitamin C, and vitamin D. So, but he also said no one died until they took the hydroxychloroquine away as well. So anyway, that's what we were doing, and none of my patients really went. No one went to the hospital. I worked with a congressman that got it. He was better in 3 days. Another congressman who was younger than him got it, and 10 days later, his lungs were on fire and everything. I said he needs to go to the hospital. So yeah, that's what I had all my patients taking, and also I have an immune builder called Conjuplex that I like, so I have people mushrooms can do the same thing where they're amping up in the body, like your T killer cells or your, um, all your cells that help take the virus down. So, those are called immune builders.
I was looking through your website and it's amazing that you are providing that resource. Why did you feel compelled to create that program to become, where you're empowering people to become their own investigator? Because a lot of people would be just like, look, buy my product, blah, blah, blah.
Yeah, because I don't sell products. Even if you come to me as a patient, any amount, I actually am very cheap. I had a billionaire who wouldn't come and see me. He told the woman who recommended me, she's too inexpensive. I'm not she can't be that good. But the thing is, I'm at a university and it provides learning opportunities for other students and things like that. So they don't charge, that much. Um, but long story short, I just feel like I want to give everything that my grandmother did or my grandfather, who was from Italy, any of my knowledge, I want to give it to anybody I can. I have another website for physicians and pharmacists where they can get continuing education. And I work with one of the best doctors in America. She's in the book 100 Best Doctors in America. And she really is a fabulous medical doctor. She's internal medicine. She ran the executive medicine at University of Miami, and now she's with Dr. Agustin's clinic. But she does a lot of the webinars with me, and both of us did webinars together during COVID. Because one of my patients, she was about 80 years old, a New York Italian lady who was very worried. She was very scared because of what she was hearing. I said, you know what? There's nothing to be afraid of. Your body will take care of you. And I said, I'm going to get on and I did a Facebook Live for my patients. And I told them, look, get zinc, get vitamin D, get the Conjuplex. And if you really want to, if you feel sick or anything, take the elderberry. It was funny because it showed eucalyptus killed coronavirus. So we sell here in the pharmacy essential oils, and we had organic eucalyptus. And so my boss is over the pharmacy manager, and he is his review is based on how much money he sells or saves or whatever. And I told my boss, Dr. Alvarez, I said, yeah, I go, the eucalyptus kills it. And he's like, get that that puts out the essential oil into the air, like the steamer. And
The
the
diffuser.
pharmacy, yeah, the pharmacy manager's like, but that thing costs $65. And he said, I don't care how much it costs. Get that stuff in the air immediately. So none of us got it. I did get it about 2 years later. I got for a day, and I took the elderberry and the Conjuplex. And then the funny thing, two things that happened that was kind of funny. One, I ended up afterwards getting H. pylori, which is an almost endemic in the population. So H. pylori is a bacteria dri that bores in to your stomach, and especially Middle Easterners. I've seen a lot of them that have it. They get it, and it's the number one cause. It's a class one carcinogen because it's the number one cause for stomach cancer and also for duodenal cancer. And so I got tested, and sure enough, I had it. And I was thinking just a few months before that, I'm so lucky. All these people come in with all these digestive problems, and I have a good stomach. And then right after that, I started getting bloated and feeling pain after I eat and refluxing and burping, especially burping. I'm like, where is this coming from? But I got the test and I had the H. pylori. So
Do you know where it could have manifested, or like
well, I think somehow maybe having the virus might have kicked it off because I do think it lies dormant in probably everybody's stomach, and it's fine as long as it's dormant. And somehow it maybe released more acid because it really likes acid to grow in. It needs acid to grow, and it starts also if your stomach gets too low in acid, I think it also gets activated because it will start putting out acid. So I think it's more like an opportunistic infection.
that's really interesting because recently I went to uh, a screening with a loved one, and one of the diagnoses was that within the, when you're getting the results, and I was like, where did that come from?
Hmm.
And then I've also heard it's really weird how the algorithm finds these things and connects it, where I just happen to hear other YouTubers, for example, who were just happenstance talking about, all of a sudden I've got a diagnosis, and they've mentioned H. pylori, and I'm like, this is so weird that it's coming up. So now that it's coming up, what do you recommend people do to
Yeah,
tap into
yeah,
their
I'm really happy to offer because, well, it was funny. I also, I do a lot of meditating and prayer, and sometimes I just get answers to things. And one day this lady had gone from doctor to doctor to doctor, and she with a stomach issue, and all these, even the integrative doctors were just giving her food sensitivity, and then she said it works for a day and then I'm sick again. I said, I think you have H. pylori. You need to go see a GI and get tested. She goes, "Oh, I'm going tomorrow." So she went, and the GI said, "What kind of doctor wants H. pylori?" So listen, anybody out there that has those symptoms, you tell the doctor, a good doctor recommended it, because that's what she said. And she goes, "I want that test." And he gave it, and guess what? Her every test was perfect except for H. pylori. And I had a male medical student with me at the time, and I said to him, "Now, what would that doctor have given her or said to her if he hadn't done the H. pylori? She's crazy. She needs to go see a psychiatrist, or here's an antidepressant." Those are the two things that they would have put them on. I'm so tired, and I've never heard a man say this. They'll probably just give the antidepressant to the man. But I've had several of my women patients, "Oh, you need to go see a psychiatrist." That is such a bunch of hooey. That's code word for I don't know anything, and I'm too lazy to go look to see what you have. So
That
anyway,
seems so disappointing.
right. So I said, so at the time, my doctor, my boss was a different person. She's a very brilliant doctor. She's in her 70s, and she really is so smart. And she was a pathologist before she got into integrative medicine. But the girl came back and said, "Well, I'm going to do the drugs that he wants us to do." I said, "But we have some natural things." And she's like, "No, no, I'm going to do the drugs." So I called my boss and I said, "I'm so disappointed. What should I do?" She goes, "Oh, do nothing." She said, "Those drugs are so horrific. People quit them after one dose. So let her go and do the drugs, and she'll be back." The next day she called. She goes, "I can't take these drugs. My stomach's like on fire." Well, interesting enough, something called black seed or black cumin seed, along with Prilosec or Nexium, which I wrote a big medical article against those two drugs. But in this hot place, you really do want to use them. They gave that with the black cumin, and it was equally almost as effective as the drugs. And I took that, and it was gone. Also, golden seal is fabulous. However, you'd have to buy the golden seal from MediHerb or from my pharmacy, which that's what we carry. And I'm not trying to hawk a product. Like I said, I don't make any money, but golden seal is so rare in this country. They grow it organically, actually, in Australia. It's so rare in the United States that they don't, like when you buy a herb in Walgreens or something like that, they don't have to use the right part of the plant for it to be effective. So they could use, a stem or a leaf or something, but for golden seal, the real medicinal properties in its roots. Same thing people will say, because I love, we have this around here. It's called saw palmetto. It's really good for men's health, but it's also good for women who get cystic acne, or if you get a mustache or something like that. We get that when we get older, because our hormones go out of balance. And they'll say, "I can go across the street at one of the big stores, that you would know the name of at pharmacy, and it's like $6. Yours is like $40. I said, "Yes, but you notice the first ingredient is the berry, and these things only berry once a year, and they're small berries." So I said, "That's where the most of the medicinal properties are in the berries." So you have to be aware of where you get the herbs from. Are they using the proper plant? I hear often people say, "Well, the FDA doesn't have enough regulation over the herbs." They actually have a lot of regulation over them, but what they don't do, and probably don't want, the pharmaceutical companies probably don't want them to do anyway, is to make sure that they're using the right part of the plant. And my we went once to the University of Illinois Chicago Pharmacy School, where they have the biggest grant to study herbs, and it's not even that much money, from the National Institute of Health. And the woman said to us, we just don't understand how these herbs work in animals and not in people. And my boss went with me and he said, Are you kidding? Did you ever hear of Commission E in Europe?" And she's like, "No, I've never heard of that." Really? Because they did huge studies. It's like their FDA, and they did huge studies of thousands of people of St. John's wort, milk thistle, all these herbs, and they found them very effective in humans. As a matter of fact, they put them on prescription only. So you have to go to a doctor, and the number one treatment in Germany for depression is St. John's wort. So, so their center believes this doesn't even work in humans. But if you use the wrong part of the plant, it doesn't work and it doesn't work. So,
That makes sense. And
yeah.
there's a lot of, I mean, yeah, like it's just hard to source some of these things. And I think that, something that I've heard too is some people are afraid to, if they're on a pharmaceutical, to start trying like herbs or plant medicine, even if it's just drinking tea, because either they've been convinced by their doctor that that is dangerous, and then the other part is that there could be contraindications. So how does someone who says, okay, I want to leave pharmaceuticals, where do they go? Because it's not like, first of all, like, and then that's part one. And then the other thing is that I feel like lately, whenever I go see, like my mom, we were going to the doctor with her lately, right? And for all these bunch of months, we're doing tests, and there was not one doctor that gave a recommendation of what she should do. No
Because they don't,
medicine, no recommendation.
yeah,
Just go to that doctor, go that doctor, get this test, get that test. Let's
right.
get this test. What about what to do with this information?
They don't know what to do. And they're not looking at everything. They're taught you can only do this. And, their pharmacology now, they don't even look at the side effects. They don't want them to look at the side effects of these really powerful drugs with these black box warnings that say sudden death or, you know, today there's many journal articles that show taking drugs as prescribed is the third cause of death after cancer and heart disease. And half of those deaths are from taking them as prescribed, and the other half is from the doctor not prescribing it the right way or the drug not being given properly. And I don't think they don't teach anything like that in medical school. Like you have to, you know, rever be revere what you're doing. And the students know this. Now, I have here, I was showing it to you earlier. This is from 1970 from 1979. I said 78, but 1979. This was a physician desk reference, and I have some bookmarks here to show my students because almost half of the things in here were natural. So when I got out of school, I never even thought about, am I giving something that somebody's going to die from or get cancer from? I mean, we never even had that in our head that they were that dangerous. We did know some drugs interacted with other drugs and to be aware of that, or some drug could cause too much potassium or, whatever. So we looked for those things, but and the other thing is they put these side effects in the computer and the pharmacist just sits there and overrides them, because the doctors don't know about giving anything else. What I was telling you, there was about 10 companies that made digestive enzymes that were prescription because there's like many studies in the medical literature before that in the 70s or 60s that showed as you age, just like your hormones decrease and other things. Guess what? So do your digestive enzymes. So most of the people that are on these proton pump inhibitors like Nexium and Prilosec, they're doing themselves a great disservice because your stomach acid is the key to your health. It's the stomach is the key. Hold on just one second. Excuse me, I'm busy right now. So anyhow, the stomach is the key to your health, and you want to have a pH of 2, and these lower the stomach acids, and the studies show it makes you more susceptible to getting um, calcium deficiency, Alzheimer's, C. diff infections, which 14,000 people die from every year. So all of those types of things.
Growing up where you were seeing your family engaging, like your grandmother, in just this beautiful communion with nature, and this land where so many people are convinced it's like, have been convinced away from nature, so natural solutions, and part of it too is a fear campaign, right? Because even when you go doing research on your own, let me research this herb, for example, there's a fear campaign along with it in the search results, right? That seems to come up at the top somewhere. Does that, like,
It's
has
all
that
it's
shocked you? Do you think it's getting more pervasive?
well, there's a big spiritual component to all of this too. I do prayer treatments in my practice with people, or meditation, because fear to me is not of God, of our creator. He gave us these beautiful plants and things. So they try to put fear. You asked about being afraid of COVID. I wasn't afraid at all. I'm like, what's all the big hullabaloo about? But because all I usually watch is Food Network and um, at Hallmark. If I watch anything on TV, I like everything works out at the end on Hallmark, so I like that. Um, but I turned on CNN and they had the clock of death, and I'm like, no wonder everybody's scared. If I watched this, I'd be scared. So it made me scared, so I turned it off immediately. So, and on these TV news things, you can't even believe most of what you hear. So, and we learned that with COVID, right?
We did learn that with COVID, and now it's 2024, and the world has exploded with even more ailments, and younger people have exploded with conditions that we weren't really seeing at certain ages. What are you seeing in your client base? Are you seeing are do you have you seen those like reports them being demonstrated in real time when you are talking to people?
Oh, absolutely. So, number one, I have to tell the students when I was their age, no child had type 2 diabetes. A matter of fact, in 1982, when I got out of school, I had two people that were type 2 diabetic that I remember, and they were older women. They were in their 70s. You never heard anybody under 50 having any autoimmune, MS, rheumatoid arthritis, or whatever, which autoimmune is wrong. That's just another code word for, let me give you expensive drugs that have big black box warnings that you might die and suffer from those drugs. So what I'm finding a lot of people have. I just had one yesterday, a man 40 with MS who's beginning not to be able to walk. I had a very wealthy 35-year-old, which was very funny because he just sold his company for like $250 million or something. And he's like, and what I asked them, were you on a lot of antibiotics when you were a kid? And he said, yes, I had chronic ear infections like every other month. And my mom put me on antibiotics. Same thing with this kid. A matter of fact, this 40-year-old man is living with his mother in New York, and his mother was in the background saying he was always sick. And yes, even his teeth got discolored. I said, "That was from tetracycline." He goes, "Yeah, because he was on it, tetracycline and ampicillin so much." So what that does, it kills the good bacteria. So one of the first lessons that I show in my course, but also of my students here, we go to Harvard website and it says rheumatoid arthritis, we don't know what causes it. Then we go to the medical library. There's 350 studies in PubMed, and I show you how to access PubMed from your computer. 350 studies that says, and you might not know the cause because it says the pathoetiology, which means the etiology means the cause of is your commensal bacteria. So bacteria that's in your gut, that basically to translate that. But there's 350 studies that are telling you this. And then I told you my former boss used to be a pathologist. She said, Lynn, we used to could do cool things back in the 70s, and we would go do a punch biopsy of the nodules of the rheumatoid arthritis. She goes, there's all sorts of bacteria roaming around. So I got part of why I got my job is a girl got diagnosed at age 2 with rheumatoid arthritis. By age 10, she had bleeding ulcers from prednisone. By age 15, she had a tumor the size of a grapefruit from methotrexate and Humira. Fortunately, they didn't diagnose it as cancer, but she had the tumor removed. And by 17, she could hardly walk when she came to see me, and her wrist and her shoulder had fused together. And 6 months later, she came here and they go, what happened to you? That she goes, oh, I don't have rheumatoid arthritis anymore. I can do jumping jacks. Funny enough, this MS patient's mother, she had rheumatoid arthritis. She goes, you know what? I knew it was from the gut. I knew his things from the gut. And she said, I cured myself of rheumatoid arthritis. I changed my whole diet and I went on probiotics. And I'm like, yeah, and take natural antibiotics, kill these bad bacteria, because what happens is they grow in the gut and then they cause inflammation. So now you have these tight junctions in your gut that says, oh, calcium, good, you need more calcium, and it lets it out of your gut. Oh, lead, we don't need that in our blood. Let's keep that tight so that doesn't, get into your bloodstream. So what happens though, when you get the inflammation, because the immune system keeps trying to get rid of these bacteria, and you get chronic inflammation and pain and other symptoms. So now those bacteria can leak out, and certain bacteria like the thyroid, certain ones like the nodules, certain ones, UC Davis did a whole thing about a bacteria that causes MS. And they actually had a piece that said the more antibiotics you used as a kid, the more likely you were to get rheumatoid or MS. So anything they call an autoimmune is okay. They told me not to look for anything because there's nothing there, because Harvard said they have no idea what causes it. So I'm not going to look. I'm just going to be a good boy and girl doctor, and I'm going to give exactly what I'm told to do.
Wow,
And
that's
when yeah,
disappointing.
and when I cured this girl, the people that were most upset were her parents, because they belonged to a group of kids that had the rheumatoid arthritis, right? A parents, right? A support group. And their doctor was telling them, no, you can't do what she's telling you. If you go off this drug, you're only going to get worse, and then there's no coming back.
And
And
the
and
thing
these
is
people
that
are
some of the
mind
doctors
controlled.
say
It's
that
not,
with
I'm sorry, they're mind control. It's not like they're
mm,
trying to hurt the people. They believe what they just said is the right, responsible thing to say. So I don't blame the doctors. And right before COVID, when I was in the medical school, the dean was really concerned because it was the highest rate of suicide amongst doctors, and I'm sure it's even gone up after COVID. So yeah.
why do you say that? Why do you think the correlation with the doctors, I mean?
Well, because the doctors have lost all autonomy. After the Affordable Care Act, basically the corporations have taken over the hospitals. And because they had to have the electronic medical record, it costs about 250,000 to 500,000 for them to get that into their office. And so all the mom and pop doctors that were, on the the Puerto Rican mom and pop doctor, or the Italian, who really cared about their community, cared about what they're doing, they got wiped out because they couldn't afford that. And then in the hospitals, there's only three ways you can get admitted to the hospital: in an emergency room, from a surgeon because he's doing a procedure, or from your insurance company, a hospitalist. So if a doctor's taken care of you for 25 years and knows you inside and out, they don't have hospital privileges anymore. And those doctors are in groups that are run by corporations. So I was telling them, because my brother was in the hospital and he was magnesium deficient, and I kept getting in a fight with his cardiologist, and he kept telling me such, and he was all Ivy League educated, by the way, and he kept telling me crazy stuff like, oh, you only even though the lab shows he's magnesium deficient, you only give it when the QR wave is short. And I go, who's teaching you this? I mean, and I asked a friend of mine who's my age, who's the type of cardiologist he was. And I said, did you ever hear that? He's like, no. I go, do you use magnesium? Yes, all the time. And this older doctor that I was telling you, who's in her 70s, said, Lynn, we used to carry magnesium sulfate syringes in our pocket because it's like the miracle for the heart. Now they're telling the students, oh, you can't give, don't ever give anybody with arrhythmia magnesium. Well, most of the people with arrhythmia, they need magnesium.
That's unbelievable.
It's unbelievable. It's
But
just
it is
all been taken
believable in
over.
this
Yeah,
dystopia that we find
right.
ourselves in. And thank God that we have people like yourself, saying, I'm going to leave a wealth of resources available at my website where no one can take it down, because I'm imagining that you must deal with your versions of technical hiccups and censorship here and there.
Yeah. There's one video that always gets taken down, and that's called the Doctrine of Signatures. And it just shows every plant or food that heals your body, it looks like your body. So, for instance, your walnut looks just like the brain. It's got the folds in it inside, it's got the different compartments. That is very high in DHA. I think it's the second or third highest in DHA. I think salmon is before it, but it's one or two anyway. Um, it looks like the brain. It's good for the brain. Your heart looks. It's red. It's in four chambers. A tomato, they've genetically modified them, but they should be in four chambers. It's high in lycopene. That's fabulous for the heart. The kidney looks like a kidney bean looks like your kidney. There's actually a study. I went after did this video, or for doing the video, I looked for research. Yeah, there's actually a study in the medical library how kidney beans help your kidneys. Olives, they grow it the way they grow. They look just like ovaries. They help with female health. A Another thing that helps with the baby and female is avocados. That fat is so good for your hormones, and it looks just like a uterus, and the seed looks just like the baby. And guess what? I have avocados. It takes 9 months for it to come to term, just like a baby does. Your the ones that have a lot of seeds, not pomegranate, fig Newtons, they grow two to a sack, and they're good for sperm. So they look like the testicles, and they help the testicles. Ginger looks just like your stomach. It's amazing for your stomach. It increases digestive enzymes. It helps heal. It helps nausea. So many things. It also is a COX-1 and 2 inhibitor, just like Aleve or Motrin. And not only like those things hurt the liver, it actually it repairs your liver like 5 different ways. It will help repair your stomach instead of causing ulcers. And I tell people, just make a ginger juice. Just throw a piece of ginger in with water, let it soak. and for 4 or 5 hours, and then drain it off, and now put it in the refrigerator. You've got ginger juice. Just take that when you feel pain, or put it in some water, or put it in club soda with a splash of agave. You've got your homemade ginger ale. So you want even further anti-inflammatory, make it into a kitty cocktail and put some cherries, crush some cherries into it. So you got a kitty cocktail. And cherries also are COX-1 and 2 inhibitors like Aleve and Motrin, turmeric, garlic, all of these things help inflammation to a great degree. And you can take these all day long. You don't have to worry about getting ulcers and things like that. The other recipe is there's a drug in there called ananase. Used to be a drug, and it's from pineapple. And pineapple has an ability to break down blood clots, and that's what we're using it for. But it also helps break down protein, so you can also use it for a digestive enzyme. So one of the things I did for myself, because I have very flat feet and I do have some arthritis in my feet, but if I take my fish oil, my turmeric or ginger, I like turmeric better because ginger can be a little harsh on my stomach. So that's why I like mixing it with the water, because it's not as strong on my stomach. But just take the core of the pineapple. We all throw it away, but that's where the most healing properties are, is in the core. And just put it in some hot water, boil some water, get a glass jar, put the core of the pineapple in there, let it soak at room temperature for like 4 or 5 hours to get more of the medicinal properties out. Put it in the refrigerator, and it's a fabulous drink for all week long that you can have. And I said I did it for a week myself, and my feet didn't hurt at all. I said, "Gosh, I'm going to do what I tell my patients to do. So I'm going to make this." And now I have it. I bought another pineapple, and pineapple is a great thing if you're having digestive issues to eat after the meal. So is papaya, because those have digestive enzymes to help break down the protein. Actually, they use the bromelain in Adolph's meat tenderizer to start breaking down the protein, making it easier. Sorry, I get so excited about it
No,
all.
I mean I love having this conversation because it's definitely a welcomed break from my everyday plight of doing independent media and content creating, and it's so focused on certain things that it's taking me away from this, which is one of my loves, to learn more about this, to learn more about nature, especially because I'm in this urban jungle, New York City, that wants to convince us to be more away from nature. Down to even, I love cooking with the gas and the fire, right? And we had to give up our gas stoves, and now we are with using an electric stove. And I feel like I'm learning to cook for the first time. I keep burning food. I keep undercooking it, overcooking it. It's too dry. Um, it's discouraging, Dr. Lynn.
Well, you know what? Prayer works. And this is something, again, that I am writing a book on, is how you use prayer. And also, I I was raised a Catholic, but and I had a great priest, and I loved the Catholic Church at the time, but I left it after some of the things that they didn't do for all the problems they had. So I actually started going to what they call the Church of Religious Science, and basically it's looking at the teachings of the Bible from a scientific perspective. So if we know that when God says all throughout the Bible, "I will heal you." That's not, oh, maybe if you're a good girl or on a Friday or if it's raining out. It's it's absolute. So if we can believe those teachings, and there are other teachings in other religions that are similar to this, so it's a common theme. If we believe those in our soul, as we believe in gravity, we don't think, "Oh, am I going to be on the ground today or floating in the air?" Right? If we believe that in the same degree, and our passion, there's nothing we can't do. There's no part of the body that can heal. There's nothing that God can't do. Well, why would there be? Because if this is our I call it God, it doesn't matter what you want to call the force. There's a force that created us. You just need to look at the biochemistry pathway to know that there's no man that is smart enough to do this machine that's like, if it doesn't go right one way, it'll go down another way. Or if you don't have, manganese, you're still living. It's going down a different pathway for right now. There's so many things of fail safes and things that are in the body, and it just it has its own consciousness of survival too. So it's so mystical and magical. And when it's so funny how plants will grow right where the disease is too. You don't find, you don't have in New York City or in New York, we don't have um, a mosquito, what is a yellow fever or other one, I'm losing the name of it, that are caused by mosquitoes. We don't have that. Well, guess what? The trees don't grow there. Those trees in the tree bark, those grow where there's a lot of yellow fever or whatever. So everywhere we go, the plants are there to help us, and they're their own chemical factory inside of themselves. So that's the way God made it, the plants and the animal tissues to help our body and to heal our body.
I want to talk a little bit more about that, Dr. Lynn, because I also grew up Catholic, and I've been disappointed by some of the recommendations from the leadership,
Right.
and that has created a lot of division too within certain communities, which is very unfortunate. But let me give you a more concrete, almost everyday example. In this conversation, Dr. Lynn happened inside a ladies' room, out of all places, because I said the word magical, and the woman who was very Catholic, I later learned, was very triggered that I used that word, and I was referring to nature.
Yeah.
What How would you have responded? Because I feel like you would have dug into an arsenal of wealth and knowledge.
Yeah, well, it's funny. She won the TV show America's Greatest Psychic, and she had me on her website, and she unfortunately died recently, but um she one of the Christian more fundamentalists called me and said, "You know what? I'm a Christian. I believe in God and the teachings of Jesus. I help anybody. Jesus didn't look at websites and say, you do this or that. People are given gifts maybe the rest of us don't understand, or people don't want people to use those gifts because it makes them afraid and takes power away from them. So that's what I find with organized religions, is that it's half of it. I was very blessed growing up. I had an amazing priest, Father Daly. He was so good to all of us kids and everything, and I loved it. But when I found out about when kids got molested and they just moved the priest, and then when I got my MBA, we had the Catholic hospital talk about how they just ship off the poor people. I'm like, I used to raise money for our Catholic Church all the time to help the poor people. So it's sad to me, the way people get triggered because, but they believe it in their soul. So I just try to smile and say, I'm sorry if I offended you. I didn't mean to. That's what I said to the lady. I didn't mean to, but I said, as a Christian, I help everyone. And if they're psychic, they're not. Um, they get sick too. Even people that I totally don't believe in what they do or whatever, I I can't not help somebody.
Yeah, I used to be a very obstinate young person, and I feel like the universe was like, oh no, we're going to bring you all of these different human beings to teach you major lessons. And one of my biggest fears was fear of just other perspectives when it comes to outside of the religious viewpoint, and meeting so many different people who use different ways and still got to the same result was astonishing to me, right? It's sort of like it starts to teach you, like, a part of it is that we are afraid of words, right? Some people are get very triggered because you said the word God. As a matter of fact, some people have discouraged me from saying it. Maybe you shouldn't say that word because some people will only think about religious. Oh, don't say the word Mother Nature because then you're going to offend the Christians. Don't say that you are connected. Don't call yourself a witch because people are not going to think that you're really talking about that you're connected to the land and it means wisdom. It's going to be that you are doing hocus pocus somewhere in the woods and wearing a broomstick or something. And look, people do different things, to each their own. But we're talking about healing and wholesomeness. That's where I'm focused. And when I see that people who are doing it and they're achieving results, even down to something that you were mentioning earlier, Dr. Lynn, when you were talking about how sensitive your grandmother was to the electrical currents, right?
Mhm.
And how many people have been diagnosed or been maybe even put down in a crazy house. There's nothing wrong with you. Are you telling me that that Wi-Fi, that you're sensitive to Wi-Fi? Are you nuts? You're saying that you touched your phone and you started feeling like you got zapped? Something must be wrong with you upstairs.
Yeah. Yeah, it's funny because I was on the board of the American Academy of Environmental Medicine, and actually, quite a few of the patients that we get have to live. There's one spot in West Virginia where they don't have Wi-Fi or the phones, and they have to live there because they're so sensitive to it. And they even showed this one lady, she would shake when the Wi-Fi was on in her office, and they diagnosed her with Parkinson's, but she didn't have Parkinson's. It was the Wi-Fi. Once they got that turned off where she was, she's fine. They actually have also put in schools electric paddles for kids that are sensitive to the Wi-Fis with their hearts. So there's just so many things we can talk about, but what we have to do is learn how to take care of ourselves the best we can, and grow plants at home that you can use with with food, or you can extract them in alcohol or glycerin or with hot water, or make them into teas, whatever, so that you can learn how to take care of yourself and your family. And you can grow these things from any, inside a windowsill, or if you have a little balcony outside, they'll grow. So you can even grow these in the middle of New York City.
I love that. A few more
Yeah,
questions as we
yeah,
wind down because you've been
yeah.
so generous with your time and I really
Thank you.
appreciate it. Uh, in relationship to what maybe three plants you might recommend or herbs that you think or are maybe like could be beneficial to people right now, or the top three, however you want to respond to that.
Well, the number one deal of the century, I think, is oregano oil. It's the Now brand. Like I said, I'm not getting paid by them. I'm just telling you what I think. But you can get like 3 bottles of this for $30, I think. It's enteric coated. Make sure you get oregano oil that's enteric coated. Oregano oil has the same kill rate as bleach, but inside the body, it's so good for as an antibiotic. It kills gram positive, gram negative. It's very good for yeast, fungal infections, and it's enteric coated, so it's supposed to release more in the GI tract. That's where you get those things more than the stomach. So that's a very good one, and it also tightens those junctions up.
How
Um,
do you recommend that people? So you say like the
if people
oregano oil, water, putting it in
No, I
water?
would no, because I don't like doing the drops. It's too
Hmm.
hot on the stomach. So I like these enteric coated capsules, and they're
Oh.
in bottles of 90. And there was one place on the internet was selling it 3 bottles for $30 or something. So I just think that's like the
Oh.
deal of the century. So get that to have, and then also if you have digestive issues, like if your stool smells or something, I would take that with my meals 2 or 3 times a day, or you could just take one a day to kind of for maintenance. I think a very good fish oil, the one I like is Old Prima EPA DHA. It's so good for pain and inflammation. Fish oil, we have that at our pharmacy. Um, the phone number to the pharmacy, it's the Nova Southeastern University pharmacy, is 954-262-4550 and press 0. And if you mention my name that you're like a patient or something, then and that you get 10% off, they'll give you 10% off, and they can mail things. We can mail things to you. If you have a quick question and I'm available, I'm happy to speak to you. And also my website, you can write me anything you want, and I try to answer questions. Now, if you're not my patient, I can't give you like medical advice because you really have to become a patient for that, but I can definitely lead you to the right direction. And then a good multivitamin, and we have here called Catalan gluten free. So, animal tissue vitamins are even at a higher level than what plant vitamins are. So, the vitamins that you see in most drugstores come from chemicals. A lot of them are made from coal tar, and they're made to look like ascorbic acid, and then they put vitamin C. But ascorbic acid, like if you were to look at an orange or peppers are very high in vitamin C. A matter of fact, the man that extracted and won the Nobel Prize for extracting ascorbic acid uh, from peppers, paprika. He said it wouldn't really help scurvy because you don't have your bioflavonoids that you need for absorption of that ascorbic acid. Now, a lot of people will say ascorbic acid really works. I take high dose vitamin C and it really works for my immune system. And it probably does work, but it doesn't probably work like vitamin C. What it does, it acidifies your GI tract, and that's where the good bacteria like to be in acid. So your stomach should be a pH of 2, and the rest of your GI tract is between 5.5 and 6. So it's acidic. The standard American diet makes the GI tract very alkaline, and yeast in particular, but the bad bacteria too. They love a pH of 7. They like a higher pH to grow. So that's why a probiotic is very important, because lactobacillus, the lacto part is for lactic acid. It makes lactic acid in your GI tract. So when you have more acidic environment, 80% of the immune system is actually in the GI tract. And those bacteria also make vitamins for you and help absorb B12 and things out of your steak or, whatever. But for instance, you use tetrahydromethylfolate. You don't use folic acid. And a lot of children who are autistic probably got that way from having this genetic it's called a SNP. It's not a genetic disorder per se. I happen to have that, what we call SNP too. So I take tetrahydromethylfolate. So they actually looked at this in a big study in Europe where they were looking for tetrahydromethylfolate. So they looked at it in mixed vegetables, there was none. They looked at it in flour, there was none. They looked at it in milk, there was a little, but when they looked in cow's liver, it was really abundant. So the cow or I said cow liver, the study had pig liver, but the cow or the pig or whatever, they're going to make the vitamin that our body actually uses. So actually, Lilly Pharmaceutical, which is a huge pharmaceutical company to this day, but it was the biggest pharmaceutical company when I was just got out of pharmacy school. And they had a whole line of prescription vitamins, and they all started with cow's liver. And those of us that are older will remember the Doan's liver pills, and I know there's a couple of companies now that are coming back with liver to take liver as a vitamin and add some other things to it. So that's basically what these vitamins do. It's all animal or plant based vitamins. So that's what I use. And people will say, I'm 65 and people go, oh, you have such good skin. Or a lot of my patients will come back. I'll just give them those vitamins and a fish oil and they'll say, oh, everybody thinks I had a facelift, and it's just from your skin is your biggest organ and you have to feed it properly. And a lot of times when you're feeding it those vitamins from the drugstore shelf or even ones that cost a lot that doctors have in their office come from chemicals, the body has to process that. And it takes a lot of work out of the body instead of just feeding naturally what it needs.
Well, you've given me extra incentive to I wrote that number down that you gave
Okay, well,
us.
call me.
Yes, and then the other thing, Dr. Lafferty, for people who are wanting to improve their health, you are still accepting people to
Yes,
see you?
so you
Okay.
can call that number and make an appointment. They'll schedule you for an appointment with me if you want. And if you have a question, you can call me. And you can also go to drlynlafferty.com and you can ask me a question if it's a longer question that way. Also, what I'm going to do today is give if anybody wants to join the course, Cafe 25, I will give you $25 off. That the course is usually $125. Don't buy it right this minute. I've got to call my web designer so that they put the code in and try it tomorrow. And yeah, so I'm really excited. And any way I can help your people. I know you have a great following, so and your heart is in the right place. So anything I can do to help.
Thank you. I will
Yeah,
definitely be diving into your website as a
thank
resource, and I look forward to calling this number because, I've been doing even like my own research and even down to like probiotics. It became like, which one do I choose? Where do I get it from? So I'm imagining that I could get my probiotics just from calling this number. Can you give the
Yes,
number again? Because I'm
yeah,
pretty sure that people are going to be like, but what was that number? I missed it.
954-262-4550. Um, Press 0. And yeah, I don't use always the same probiotics. So actually, probiotics, the ones I say, oh, 50 billion, whatever, those actually can cause too much lactic acid and cause problems in the brain. I use those like if you just got back from a trip and you have really bad diarrhea or you got a digestive condition, you want to use a high, or you're on an antibiotic, you want to use a high dose for a short period of time, 2 weeks to a month. And then what you want to do is get one that's a lower number but has a multiple strains that can help in different ways. So we have something called prosymbiotic that I use on a long-term basis, and prosymbiotic with St. John's wort is so good for your mood. I always feel great whenever I take those 2 things together. So,
You have been such a
yeah, thank you.
resource of wisdom and knowledge. I thank you so much for your
Thank
time.
you.
This has been so wonderful to me. I feel
Thank
like
you.
I've been sitting in the woods with you chatting.
Well, look at the beautiful plants, and anytime I would be happy to come back, and thank you so much for having me, and I love what you're doing, so keep up the good work.
Thank you, Dr. Lynn. God bless you. And we look forward to chatting with you, and I look forward to calling that number.
Okay, thanks.
Take care. All right, mi gente.
And
This has been Dr. Lynn. She is a wealth of resource. Please go visit drlynlafferty.com. Remember that number. If you don't remember, page rewind back the show. I went back old school and check it out. If not, just click the link below from the summary link of the show, and it will take you directly to her website. Thank you again, everybody, for tuning in, and we'll see you next time. Thank you, Dr. Lynn.
hasta luego.
Hasta luego. Gente, take a moment to subscribe to Cafecito Break. Su familia que nosotros estamos aquí presentes.